Okay, so there's this projection, right, that by 2050, the number of people age 60 and over globally is set to double.
Double, yeah. And what's really quite striking is how fast this is happening compared to the past.
Much faster.
Yeah,
So let's really dive into this demographic shift and what it means.
absolutely. This deep dive, we're focusing squarely on the health, the well-being of older adults. And we've looked at, well, a whole range of sources, things
Hmm.
like government policy. We looked at the UAE, but also global health views from the WHO and insights from health groups like NCOA, Cleveland Clinic, just trying to get a full picture for you.
Exactly. Because for you listening, we know you want to grasp the important stuff quickly without, wading through tons of dense material.
Right. Consider this your curated guide. We've pulled out the key knowledge on senior health.
So our mission here is pretty straightforward. Give you a comprehensive but still, digestible overview. What does healthy aging mean? What are the common bumps in the road? And crucially, what practical tips and resources are out there?
Precisely. So maybe the best place to start is, well, who are we talking about? What does senior actually mean in this context?
Good question. Where do we draw the line?
Well, if you look at the official definition used in the UAE, for example, they define a senior as someone who is 60 years of age or older.
60. Okay. And I found it interesting they use the specific term senior Emiratis. It feels like it gives a nod to their contributions, doesn't it?
It does, yeah. It signals respect. Now, zooming out to the global view, the World Health Organization highlights something pretty significant.
Which it.
By 2050, they estimate that 80% of older people will be living in low and middle income countries.
80%.
Yeah.
Wow, that's a huge majority, a major shift.
It really is. And, some high income countries are already quite far down this road. Take Japan, about 30% of their population is already over 60.
30%. Okay, so the world is definitely aging, but unevenly. What's actually happening biologically as we get older? What's the underlying process?
Well, at its core, aging involves the gradual accumulation of molecular and cellular damage over our lifespan.
Damage, like wear and tear.
Kind of, yeah. Think of
Yeah.
it like that. This buildup slowly leads to a decrease in our physical and mental reserves, our capacity, and importantly, it increases our vulnerability to disease.
So it's happening deep inside, not just wrinkles and gray hair.
Exactly. And crucially, these changes aren't like a set path. It's not linear. It varies massively from one person to the next.
Right.
And we also have to remember aging isn't just biological. It often coincides with big life changes, retirement, maybe moving, losing people close to us. That all plays a role in well-being.
That makes total sense. So thinking about health specifically, what are some of the common conditions that tend to crop up more often as people age?
The WHO lists several really common ones, things like hearing loss, cataracts affecting vision, back and neck pain, osteoarthritis, that joint wear and tear,
Oh,
also COPD, chronic obstructive pulmonary disease, diabetes, depression, and dementia.
that's quite a list.
Yeah.
And I guess managing one thing can affect others too.
Absolutely. That interconnectedness is key. For instance, getting diabetes under control can seriously lower your risk for heart problems or even cognitive issues down the line.
It sounds like it can get complex quite quickly.
It definitely can. And the chances of having more than one condition at the same time, what doctors call comorbidity, that increases with age.
Right.
Plus, we start seeing what are known as geriatric syndromes. These aren't single diseases, but more like clusters of symptoms. Think frailty, that increased vulnerability we talked about, or falls, which become a bigger risk.
Frailty and falls. Okay, so
Yeah.
given all this, what actually influences how healthily we age? What factors make a difference?
Well, the WHO really stresses that good health is what enables older adults to keep doing the things they value, to stay engaged.
What's that?
And while genetics, our genes, they do play a part, it's actually our physical and social environments that have a massive impact.
Environment, like where we live.
Exactly. Our home, our neighborhood, our community, and also personal factors like gender, ethnicity, socioeconomic background, all these shape our aging experience significantly.
So it's not just about our individual choices, like diet and exercise.
Not entirely, no. Actually, the environments we're exposed to throughout our lives, even way back in childhood, can cast a long shadow on how we age.
Really? Childhood.
Yes. Our surroundings can directly impact health, or they can create barriers or enablers for healthy behaviors. Think about access to safe places to walk or affordable healthy food.
That's a really important point. The broader context matters.
Hugely. And of course, healthy behaviors throughout life are still vital. A balanced diet, regular physical activity, not smoking. These are pillars for reducing chronic disease risk, boosting physical and mental function, and delaying the need for care.
And supportive environments help make those healthy choices easier.
Precisely. Things like accessible buildings, reliable public transport, communities designed for walking, it all fits together.
Okay, let's circle back to the UAE specifically for a moment. You mentioned their focus on senior emeritus. What does that look like in practice? What support is in place?
They've put in place some quite strong legal protections. There's Federal Law Number 9 of 2019, which guarantees senior emeritus a whole set of rights.
Such as?
Things like the right to independence and privacy, protection from abuse or neglect, the right to an enabling environment, so suitable housing, education, work opportunities, also comprehensive social and medical care, confidentiality of their information, and even preferential treatment in government services and healthcare.
That sounds pretty comprehensive. Is there any enforcement, any teeth to that law?
Yes, definitely. The law specifies penalties, fines, even imprisonment for caregivers found guilty of abuse or neglect, and also for institutions that don't meet their obligations under the law.
Good to know there's accountability built in. What about the wider strategy, beyond the legal rights?
They have a national policy for senior emeritus, which is built around this idea of integrated care. The goal is to keep seniors active and ensure they can easily access government services.
Integrated care, what does that involve?
It's based on 7 main pillars. Let me see. Healthcare is one, obviously. Then community involvement and active living, civic participation, infrastructure and transport,
Okay.
financial stability, safety and security, and planning for quality of life in the future.
7 pillars. That covers a lot of ground.
It really does. And practically speaking, the UAE government provides a bunch of online services designed for seniors.
Like what kind of services?
Access to care facilities, home care programs, rehabilitation, social assistance, help with transport like discounts or free parking in Dubai for those eligible, and even discount cards for shops and restaurants.
And are these online services actually easy for older adults to use? That can sometimes be a barrier.
That's a key point, and they seem to have focused on it. They mention features like larger fonts, high contrast colors, text-to-speech options, descriptive text for images, trying to make digital access genuinely user-friendly.
That focus on digital accessibility is smart. It anticipates potential hurdles. How does that compare generally to what other developed countries are doing? Is it making a difference?
That's a great question. It certainly seems like a proactive approach. Compared to some other places, it feels quite coordinated, trying to anticipate needs rather than just react. The potential impact on seniors actually using these services could be significant if done well.
Right. What about the money side of things and the social aspects for seniors in the UAE?
Financially, senior citizens who reside in the UAE are entitled to monthly social assistance under a federal law from 2001, and we mentioned those transport discounts in Dubai.
Yeah.
Socially, though, the challenges are quite universal, really. Seniors in the UAE, just like elsewhere, can face issues like loneliness, maybe struggling with daily activities as they get older, frustration with health problems, social isolation, perhaps feeling a bit lost after retirement, boredom, financial worries. These are common human experiences magnified sometimes in older age.
And those social factors, they really do feed into overall health and quality of life, don't they?
Oh, absolutely. Which brings us back to why focusing on lifestyle adjustments for healthy aging is just so critical. Diet and exercise are really the cornerstones.
Okay, let's talk diet first. What are the key recommendations coming from the sources?
The big emphasis is on high-fiber foods. So think whole grains, beans, nuts, seeds, lots of different fruits and vegetables. Colorful ones are usually a good bet.
Fiber is key.
Yeah. And trying to cut back on fried foods, maybe broiling, grilling, or boiling instead. Getting enough vitamin D and calcium is also highlighted, often through fortified foods or maybe supplements, especially for bone health.
Right, bone health is a big one.
Definitely. Staying hydrated is important too, drinking enough fluids, even if you don't feel as thirsty as you used to. And the general advice is nutrient density.
Nutrient density, getting the most nutrition per calorie.
Exactly that. Getting the most bang for your buck nutritionally, also watching portion sizes, maybe planning meals a bit, and limiting the obvious culprits, sugary drinks, unhealthy fats, too much salt.
Are there specific vitamins or minerals that become more important as we age?
Yes, the sources mention B vitamins, specifically B6 and B12 vitamin D again, and folate as being particularly important. Certain minerals too.
So should older adults just start taking supplements?
Well, it's always best to chat with a doctor or a healthcare professional about individual needs. They can look at your diet, your health status, and advise if supplements are actually needed. It's not one size fits all.
Good advice. And what about managing healthy eating on a budget? That can be tough.
It can, but there are tips. Things like buying store brands instead of name brands, looking out for sales and using coupons, choosing affordable nutritious options like canned beans or frozen vegetables, low sodium versions if possible.
Smart tips. Okay, let's switch gears to exercise. What are the main benefits for older adults, and what kind of activity are we talking about?
Oh, the benefits of exercise are huge. It helps with managing weight, improves cholesterol, builds endurance. It's great for heart health, helps deliver oxygen better.
Yeah.
It strengthens bones and muscles, which is crucial for reducing fall risk. Plus, it boosts mood and can even help with sleep.
So pretty much benefits everything. What types of exercise are recommended?
Generally, a mix is best. Aerobic exercise like brisk walking, swimming, cycling gets the heart rate up. Muscle strengthening exercises using weights or resistance bands are important for maintaining strength.
Uh,
Balance exercises are key for preventing falls, things like standing on one leg. And flexibility exercises like stretching help maintain range of motion.
a bit of everything then.
Yeah, variety is good. And don't forget the social side, staying connected with family, friends, community groups, that's also seen as part of an active, healthy lifestyle.
Absolutely. Beyond diet and exercise, are there other lifestyle tweaks that make a difference?
Yes, quite a few actually. Limiting alcohol is often advised. Quitting smoking, obviously, is a huge one at any age. Protecting your skin from the sun.
Good point.
Maintaining good oral hygiene, brushing, flossing, seeing the dentist, being proactive in your own healthcare, asking questions, going for checkups. Regularly reviewing medications with your doctor is really important too, to avoid interactions or unnecessary meds. Keeping up with recommended screenings and vaccinations. Getting enough good quality sleep. Staying socially active. Even taking holidays. It all contributes.
It really paints a picture of needing to be quite proactive and holistic about it.
Exactly. It's about managing the whole picture as you age.
Okay, let's dig a bit deeper now into some of those specific health challenges. We mentioned some earlier, but what are the really common conditions older adults might face?
Sure. The sources, like MedicineNet, actually list quite a few, often categorizing them by body system. So you have musculoskeletal problems like osteoarthritis, that joint wear, and osteoporosis, the thinning of bones.
Right, those are very common.
Then, hormonal issues like diabetes, thyroid problems, neurological conditions become more prevalent, dementia, Parkinson's disease, stroke risk increases, and of course, issues with vision like cataracts and hearing loss.
Okay.
Cardiovascular disease is a big one, heart attacks, high blood pressure. Respiratory conditions like COPD, kidney disease risk can go up, skin changes, hair changes.
It's quite a list.
It is. Also, an increased risk for certain types of cancer, bone marrow, or immune system issues, gastrointestinal problems, urinary problems like incontinence, oral health issues, a generally higher susceptibility to infections, and mental health conditions like depression and anxiety are significant too, alongside general issues like fatigue and falls.
Wow, that really underscores why specialized care might be needed, doesn't it?
Absolutely. And that's
Yeah.
precisely where the field of geriatrics comes in.
Tell us a bit more about geriatrics. What does that kind of care actually involve?
So geriatrics is the medical specialty that focuses specifically on caring for older adults. It acknowledges the unique mix of medical, social, and functional challenges that often come with aging.
Okay.
A really key part of it is something called the Comprehensive Geriatric Assessment, or CGA. It's seen as the gold standard, especially for assessing things like frailty.
Comprehensive assessment. What does that mean in practice?
It means it's not just one doctor. It typically involves a whole team, nurses, physical therapists, occupational therapists, pharmacists, dietitians, social workers, all working together.
A real multidisciplinary team approach.
Exactly. They look at the whole person, their physical health, mental health, functional abilities, social situation, to create a coordinated care plan.
And what kind of services fall under geriatric care?
It's quite broad. It can include acute care if someone is hospitalized, specialized services like orthogeriatrics for older patients with fractures, special assessment teams, often called OPAL teams, in emergency departments to identify frail older patients early, inpatient rehabilitation units, outpatient clinics for ongoing management.
So it's about tailoring care to the specific, sometimes complex needs of older people.
Precisely. Geriatricians are trained to recognize that illness might show up differently in older adults, maybe less specific symptoms. They focus on those common issues like falls, mobility problems, incontinence, confusion, and they're very mindful of medications and potential side effects or interactions, which is a huge issue.
It sounds like a much more holistic and necessary approach as populations age.
It really is. And it's vital because, as the WHO keeps stressing, there's no such thing as a typical older person. The diversity is immense.
Right. You could have an 80-year-old running marathons and another needing significant support.
Exactly. Some people maintain incredible physical and mental function well into later life, while others might experience declines much earlier. This huge variation means we need a public health response that's flexible and addresses a wide spectrum of needs.
So what are the bigger societal hurdles we face in adapting to this aging population?
Well, one major challenge is ageism, those negative stereotypes and discriminatory attitudes towards older people.
You mean seeing older people as frail or dependent or a burden?
Exactly that. Unfortunately, those attitudes are still pretty widespread. And they're harmful because they can lead to discrimination, limit opportunities, and even negatively shape policies related to aging.
How do we combat that?
Awareness is key, and there are global efforts. The UN actually declared 2021 to 2030 as the decade of healthy aging, with the WHO leading the charge.
The decade of healthy aging. What's the focus there?
It's about changing how we think, feel, and act towards age and aging. It's promoting age-friendly environments. It's pushing for integrated, person-centered healthcare, and ensuring access to quality long-term care when needed.
So a multi-pronged approach.
Yes. And part of that is also really focusing on those specific issues common in older age falls, mobility, incontinence, confusion, managing medications safely. Tackling those directly is crucial.
It seems like staying informed and being proactive, both individually and collectively, is really the way forward. What resources would you point people towards if they want to learn more?
Absolutely. There are loads of great resources. For the specifics on the UAE, the TAM portal, the Ministry of Community Development website, and Sharjah's Social Services Department are good starting points.
Okay.
Globally, the World Health Organization, WHO website is packed with information. In the U.S., the National Council on Aging, NCOA, and Medline Plus are excellent. Reputable health providers like Cleveland Clinic or insurers like Cigna often have useful sections too.
Any others?
Yeah, websites like MedicineNet offer good summaries. Health Direct in Australia is another reliable source. And for a UK perspective, looking at NHS trust sites, like the St. George's one we mentioned, can give insight into geriatric services.
Lots to explore.
Definitely. And fundamentally, the most important resource is often your own doctor or healthcare team. Keeping that communication channel open about your own health, your concerns, your needs, that's paramount.
So if we had to boil it all down, what's the single most important takeaway from our deep dive today?
I think the core message is that healthy aging isn't just one thing. It's this dynamic process shaped by our choices, yes, but also hugely by our environment and the support systems around us. Being proactive, engaging with your health, and tapping into available resources can genuinely make a massive difference to your quality of life as you get older.
That's a great summary. And to leave you, our listener, with something to chew on. As our world continues to age, what do you think are the biggest, most critical shifts our communities and our healthcare systems need to make? How do we truly support healthy, fulfilling lives for all older adults? Really think about that balance between what we can do as individuals and what we need to do together as a society to promote well-being right across the lifespan.